Today I will be performing a trach dressing change. First I will knock hand hygiene, introduce myself to the patient, two patient identifiers, letting them know what I'll be doing today. I will put the pulse ox on one of my patient's fingers to make sure I know their oxygen level, and I will check the humidifier level and the oxygen level that they are on while I'm cleaning or while I'm changing the dressing. Then I will open my trach kit and with the little sterile water in the basin, I will put a 1/2 inch to 1 inch of sterile water in there, and then I will put the sterile saline aside, and I will not close it yet just in case I need it for anything else. I will then apply my sterile gloves, which I will not do on camera because they do not fit as well, but I already know the procedure of applying my sterile gloves. And then if my patient has a disposable cannula, I will remove that and throw it away. If they do not, if they have a non-disposable, I will take it, put it in the sterile water, use the brushes and such to clean the inside and around of it, and then I will be able to back and replace it. And then I will take the gauze and put it into the sterile water, and I will clean the exposed surface of the outer cannula, and I will wipe around, and then I will dispose of that, and then I will take the cotton swabs, and I will dip them in sterile saline, and then I will clean the stoma. Beginning at the inner edge, I will go outwards in circles, covering a 2 to 4 inch surrounding, and then I'll make sure to include the area under the faceplate. After that, I will use a gauze to pat everything dry, and I will apply a new drainage sponge to the patient. And then I will make sure my ties are secured if I needed to change it, making sure the ties around it are secured. And then I will position my patient comfortably, clean up my area. I will cap the bottle of saline and make sure to date it, hand hygiene on the way out, and make sure to document what I just did. Today I will be discussing how we will do a chest tube assessment as a nurse. First, I will knock privacy hand hygiene, introduce myself to the patient, do 2 patient identifiers, let the patient know what we are doing today. I will ask the patient if they're having any pain. I will make sure to extensively wash my hands. I will put on my gloves, lift up the patient's gown, and listen to the chest anteriorly, and then say that it's the left side where we had a pneumothorax. I would then listen to the middle lobe of the left side to assess for lung sounds. Next, I will check the site and the tape in the dressing where the tube is inserted, making sure it's intact and dry. I will palpate to make sure there's no cracking, crunching, tenderness, or drainage on palpation. I'll make sure the tape is securely onto the body on both parts, and then I will, all the way down the tube, I will check all the tube connections, making sure there's no leaks. I will make sure the clamp is not on so we can suction, and I'll make sure the chest tube is along the patient on the bedside and not have any dependent loops. And then I will go down to this canister and check the bellow to make sure the suction is on and continuous. I'll check the water chamber to make sure it is equal to the 2 centimeter mark. If not, I'll either have to add or remove water, and I'll make sure in the water I will check for bubbling. With each shift, I'll make sure to put a mark of the time and date of how much drainage came out, and I will not drain any of the contents in the container. I will keep tape and saline and Vaseline gauze by the bed just in case anything happens to the chest tube. Today I'll be performing facial hygiene on my patient. I will knock hand hygiene, introduce myself to the patient, 2 patient identifiers, letting them know what we're doing today. I will then put a dry towel under my patient's pillow so that there's no water that gets onto their pillow. I will grab all my supplies to wash my patient's face. I will then grab a basin, some warm water, some washcloths, and I'll make sure not to use soap on my patient's face, or when I'm using my washcloth, I will not use the same side of the washcloth for it. So starting with my patient's eyes, I will wet my washcloth, rinse it out, and as you see, I have the different flaps. So I will start with the first one. I will go under the eye, out and down, and then get a new part of the washcloth, the other eye, out and down. I will then rinse this out, and then same thing. I will now rinse off what I just did to the eyes, out and down, new flap, out and down. Grabbing a dry washcloth, I will then pat dry. Next, I will do the rest of the face, and I will grab my wet washcloth, start with the forehead, go into circular motions, making sure I'm getting by the nose, under the chin, behind the ears. I will then rinse it out and rinse off their face and all around behind the ears. And then I will pat dry, remove the towel behind my patient's head on their pillow, and make sure my patient has everything they need, and that's facial hygiene. Today I will be making a bed with a patient in it. I will first knock hand hygiene, provide privacy, let the patient know what we're doing, do patient identifiers. I'll just let my patient know that I'm going to grab some new sheets. I will make sure that I have a clean area to put my clean sheets down. I will then raise the bed at a level that I can work at. I will put on, I'll say this is a bath towel to put over my patient to make sure there is privacy at all times. I will put on gloves, make sure to remove the top sheet all the way down to the bottom of the foot, rolling it up, making sure I'm not shaking anything, and holding it, making sure to hold away from my body, and put it in soiled linen. Then I will have my patient turn over, but first I have to have my patient come closer to me, making sure to move the head, the torso, then the legs. And then I will tell my patient to roll over, grabbing the other handrails and making sure I'm providing privacy at all times. Okay, and then, oops, laying on that. And then I will roll my old dirty linen under so that it doesn't get on the new linen. Roll it under my patient, tuck it as much as I can. I will remove those gloves, put on new gloves, get my new linen. This would be my fitted sheet. And I'm going to put it on the corners of the bed, and then making sure there's no, make sure there's no wrinkles. I'm gonna tuck under the old linen, putting that out. I'll put my draw sheet down. If I need chucks, I can put those down as well. Letting my patient know there'll be a little hump for them to come over. I will put them back in the middle, making sure that they stay privacy at all times. And then this is where I would go to the other side. I would then move them closer to me and then be able to roll them over onto the new sheets, making sure that they are their privacy remain at all times. I would then remove the old sheets and put them into soiled linen, remove those gloves, put on new gloves, and put out the new sheets, making sure there's no wrinkles and it's all out. I'll have my patient go back to the middle. And then next I will do my top sheet and the blanket. I'll say this is the top sheet and blanket. So removing the bath towel, I will then put on a new top sheet, putting it over the foot of the bed, just like the blanket I would. And then we would tuck it as hospital corners, meaning that at the edge of the bed, we would stick it under. And then on the sides, we would then lift up the side, tuck the excess in, and making that fold at the end. And then my patient sheets are changed. Now I have to do the pillow. So with the pillow, we will not shake it. And I can actually remove my other gloves and do this with my hands after hand hygiene. I can grab the pillow like so, and then put it over my pillow and just push down, not shaking it. And then I can switch out the pillows for my patient. Put the head of the put the bed at floor level. Make sure the patient has their call light, and make sure to clean everything up. Everything goes into soiled utility that is needed, and that is making a bed.